How many of you are afraid of needles? Obtaining blood samples is essential for a variety of medical diagnosis, procedures, and tests. I have been doing blood draws for about 9 years. Doctors, they order these blood tests to help check for certain diseases and conditions. Although there are many different types of blood tests, I will go over the most common one, which is CBC, or complete blood test. This test is done to review your overall health, to diagnose a medical condition, and to monitor a medical treatment. Some of the things this test measures is your red blood cell, which carry oxygen, your white blood cells, which help fight infection, and your platelets, which helps blood clotting. Having this test done helps diagnose infections, cancer, anemia, inflammation, and bone marrow failure. Now we'll go over some of the supplies needed for the blood draw. You will need the tourniquet, gloves, alcohol swab, Band-Aid, cotton ball, the correct collection tube, and needle. Once the patient is in, you want to make sure that you do identify the patient by name and date of birth. You want to make sure you do the appropriate hand hygiene and the PPE. So once your patient's here, you want to get the arm, place the tourniquet 3 to 4 inches above the area. By placing the tourniquet, it slows down the flow of blood and helps find the veins much easier. You want to ask the patient to make a fist. You want to make sure you put your gloves on and practice safe PPE. You want to palpate for the vein. Once you find the site, you want to clean the area. You want to wipe down and let air dry. You don't want to fan or blow because this can cause contamination and maybe infection. Once that is done, you want to collect the correct needle and collection tube. We're just practicing. You want to grab the patient's arm below the site and taunt the skin. You want to insert the needle 15 to 30 degree angle with the bevel of the needle upward. Once the blood flashes into the tube and you collect the proper amount of blood, then you want to release the tourniquet, apply a gauze or Band-Aid, and apply pressure. This stops the bleeding and prevents swelling and bruising. And then you can apply the Band-Aid. Alright. After you get the correct blood, you want to label your tubes and check on your patient and make sure your patient is okay. As Catherine Gaines said in one of her articles, the practice of drawing blood is a skill that all nurses should learn in their career, a skill that takes time and practice to master. Getting your blood drawn doesn't require any special preparations. It only takes a few minutes. Having a blood test done can be helpful in your overall health. It helps doctors detect early on for certain medical diagnoses and diseases. Thank you.